Diabetic Management Education by Knut Swanston, Carolyn Kenny, Lauren Revis, and Victoria Fine. References from Octavius Med-Surg Nursing, 6th edition, Perry and Potter, Fundamentals of Nursing, 6th edition, and Novant Health Compass Diabetic Education Packet.
Hi, Carolyn. My name is Knut, and I'm the diabetic nurse educator here. Today I'll be talking to you a little about your blood glucose monitoring. Carolyn, the first thing I want to do is to gather my equipment. Here I'd like to point out to you my lancet, my strips, alcohol pads, 2x4 swabs, my sharps container, and my glucose monitoring machine.
Okay.
After washing my hand, I'd like to don my gloves.
Okay.
Now, Carolyn, I'll need your finger for this demonstration.
Okay.
Carolyn, the first thing we want to do is to wipe our fingers clean. Typically, we want to use the sides, as it causes less pain during the blood draw. The second thing is I'd like to obtain a strip that we have here and placing it in white side in first into the blood glucose machine.
Okay.
We'd like to take our lancet and, as indicated before, obtain the side of the finger as it is less painful. Placing it flush against the finger, we'd like to inject to obtain a blood source. The very first blood source is actually wiped away. This will remove all contaminants. We'd like to massage the finger gently to obtain a second blood source, at which time we'll take our blood glucose monitor and place a single drop on the strip. We will then wipe the finger clean and apply a Band-Aid. This will stop the bleeding. Carolyn, I'd like to remind you that the blood glucose monitor takes approximately 5 to 10 seconds to obtain an accurate reading. Please remember at all times to change your batteries regularly so you will always have an accurate reading.
Okay.
What are your questions at this time?
Okay, so I wash my hands and then I get alcohol and I swab the sides of the fingers so that I don't get the middle where the pain receptors are. And then I take the lancet and I get me a stick, and then I get some blood and I put it in on the little tip of there, and I have my reading, my glucose reading.
Very good, Carolyn. Always remember to wipe away the very first blood source so you can remove all contaminants.
Okay.
And one last thing, Carolyn, at all times when you're finished with your sharp materials, please remember to place them into your sharps container. This will ensure safety.
Okay, thank you.
Thank you, Carolyn.
Alright, Carolyn, my name is Vicki, and I'm here to demonstrate to you the proper technique to injecting your insulin. There are various sites that you can inject your insulin, like in your arms, right above your buttocks, your thighs, and your stomach area. For you living alone, it's best that you do it in your arms, your stomach, or your thigh, just because it's easier access for you.
Okay.
Now, your doctor has ordered for you NPH insulin, 15 units. This is an intermediate acting insulin, which means it comes cloudy.
Okay.
It's not mixed, but you'll need to roll it in between your fingers gently. You don't want to shake it because it'll cause bubbles that can get into your syringe. Now, this does have a life outside the refrigerator for 28 days, so you don't have to worry about keeping it refrigerated at all times.
Okay.
And this particular insulin has a peak of 4 to 10 hours, which means halfway through that peak, around the 7th hour, you are susceptible to becoming hypoglycemic. And our other coworker, Lauren, will explain a little bit more to you about that a little later. Now, the first thing you're going to want to do is to wash your hands. And for safety purposes, for yours and mine, I'm going to put on gloves. All right, and now I have set up here some alcohol pads, a typical syringe. This one has 30 units. They do come in 50 unit syringes as well as hundreds. But being that you're only getting the 15 units, we're going to use the smaller syringe. Okay? And the first thing you want to do is to take an alcohol pad and wipe the top of your bottle. This is a multi-dose vial, so each time you go to get insulin out, you do want to do that before.
Okay.
Okay? Now you want to pull back your plunger to the 15.
Okay.
And you're just filling it with air at this point. You're going to uncap the syringe and inject the air right into the bottle.
Okay.
You will then turn it upside down and pull back slowly, try not to get bubbles in your syringe, to the 15. If you do see that you're starting to get bubbles, you can go slightly past the 15 mark, give it a little thump, and then push right back up, and that should get rid of your bubbles. And if it doesn't, you can always repeat the same procedure. And you want to make sure that the end of your plunger is right on the 15 mark.
Okay.
Now, we're going to go ahead and we're going to give you the insulin in your arm. Okay, and what you do is you just pinch up the fattiest portion of your arm.
Okay.
You'll wipe with alcohol, and then you will inject at 45 degrees. Now you don't want to put your finger on the plunger just yet because you might prematurely eject the insulin.
Okay.
So you go in,
Okay.
and then you inject,
Okay.
right? And as you're pulling out, you want to keep a hold of the syringe plunger. And then you can let go.
Okay.
Okay? And then what you want to do is you want to put this in the sharps container. You might have a needle that has a safety guard, and that's great, but you still put it on in the sharps container. And you can drop any of those sharps containers off at your local pharmacies, and they will send them to the biohazard companies.
Okay. Good.
Now, Carolyn, at this time, I'm going to ask that you just give us a brief demonstration of what you learned about your insulin drawing today.
Okay. I wash my hands, and then I get my NPH and my syringe. I pull back on the syringe to 15 since that's what the doctor's ordered for me. I put the air into the NPH, and then I pull back to 15, and I make sure all the bubbles are out.
Yeah.
Okay. Okay.
All right.
And I put my the syringe into the sharps container when I'm finished.
Okay.
And I rotate sides.
Yes. Make sure that you rotate sides so that it doesn't kill your fat tissue.
Okay, great.
All right. Very good.
Thank you.
Hi Carolyn, my name is Lauren. I'm going to be talking to you somewhat about some of the manifestations of hypoglycemia and the importance of monitoring your blood sugar. A lot of people don't know much about hypoglycemia. They pretty much emphasize the high blood sugar, so I'm going to start discussing low blood sugar with you. Some of the manifestations of low blood sugar include lightheadedness, a dull headache, shakiness, sweating, pale and moist skin, pounding heartbeat, possible palpitations, nervous irritability, and you could possibly lose consciousness at some point. If you ever feel like your blood sugar is dropping, you definitely want to check your sugar if you're able to. If you're not able to, there are certain things you can do anyway. You want to somehow ingest at least 15 grams of carbohydrates. One way to do that is with these little glucose tablets. They're easy to carry with you. You eat 3 or 4 of these, and it should bump your glucose back up.
Okay.
Also, we have the glucose drink, and it does the exact same thing for you. But you can also use fruit juice, soda, milk. Actually, I think it's a tablespoon of honey, 4 teaspoons of sugar, or 3 to 8 lifesavers, which will bring your glucose up. And you want to recheck it in about 15 minutes.
Okay.
And if it's still not up, again in 45 minutes, if you can. You want to make sure you do check your blood sugar regularly, at least 3 times a day. And if it's ever over 400, you want to make sure you always call your doctor. That's very important that you do that.
Okay. Okay, so I take the glucose if I'm low, or I'm feeling shaky or headache or feel bad. I take either the glucose or the glucose drink. And if my blood sugar's over 400, I call the doctor.
Exactly. And when are you going to check your blood sugar?
When? I'm going to check it 15 minutes after I take the glucose.
And at least 3 times a day, right?
Yes. Thank you.
All right. Do you have any more questions, Carolyn?
No, you guys have done a great job.
Thank you,
Thank you,
Carolyn.
Carolyn.
Thank you.
Carolyn.